Thank you for sticking out to the end, and congratulations to the panelists. Phenomenal companies and just phenomenal progress. My name is Rishi Madhok. I'm the CEO for Rejuvenan, and I'm going to talk to you about our clinical wellness platform. What we've seen is we've developed a platform that combines deep nutrition, fitness, stress reduction, and combine that with medical therapy to create an experience that is personalized to our users and delivers what we call whole care. Very proud of the traction we've had this year in partnerships such as the City of New York and the Department of Aging that we've been able to onboard. And I'll take you through a bit of that briefly. So the problem, I don't have to belate too much because everyone said it quite a few times, but healthcare is fragmented. It's difficult to find solutions, and people who are ill-informed consumers trying to find the right solution for them in a misguided way. What Rejuvenan does on its platform is we align with our member. We find out what do they need, what do they want, what are they willing to do. And through an integrated mix of human touch and technology, we create alignment through a health experience, providing them the solution when they need it, when they're most likely to act on it and receive an outcome from it in the end. We did that by taking healthcare, which is truly an engagement in that nutrition, fitness, lifestyle, and combined it with sick care, right? Traditional medical therapy, mental health, and have brought it into one platform. And to do that, we have a team that is accomplished to have done this before. Fred Nazem is our founder and executive chairman, who's still very actively involved. He turned around Oxford Health. He has IPO'd over 60 companies, 3 of which he co-founded. He's got a fantastic background and much my senior. I myself an emergency physician, but also a background in clinical informatics. Have exited before and developed an understanding in blockchain and machine learning. And the team goes on to have experience in both insurance, medical, but also we made an investment in nutrition from the very start of Rejuvenan. And really what Rejuvenan does is it adds years to your life and life to your years through our process, right? We want to be able to create longevity and really a quality of life for all of our members. And that is what we've been able to do regardless of where you come into the platform. We do that by bringing members onto our platform. They're able to consult with, we have a medical practice that staffs all 50 states, can prescribe, can refer, can navigate you to care. But that process also creates an objective score of your health using 10 biomarkers that we did the research on based off work that won the Nobel Prize in 2009 of telomere and mitochondrial research. These 10 biomarkers are used to drive a Rejuvenan experience that brings in nutritional content, fitness, communities, challenges to empower our members to reach their version of health. And I see the content as very premium. We've seen this year through Peloton and other such companies, treating your patient as a consumer is how you get the alignment. We have Nike brand ambassadors, Lululemon, non-hydration, New York Times 3-star chefs providing the recipes and the content to really empower our members to a really premium, phenomenal experience. We do this at scale through the technology we've developed as a company. We have our own proprietary risk detection and treatment recommendation engine, which drives the experience and creates the experience. Earlier this year, we actually coupled that with machine learning and a process of deep learning to go from hundreds of experiences to combat chronic illness and disease through our experiences to now thousands. And all of this is based in deep nutrition, fitness, mental health, social support, coupled with that medical support from our team. Just to get an idea of how we scale, we implemented technology where it made sense to scale our providers, to enhance our experience. So in our medical visits, we have the system that watches and learns and triages patients, now can triage over the top 100 complaints of urgent care, triages them to the right provider at the right time, but also helps follow up the patient and drive them on behavioral nudging and around their health experience. We use the same process to create daily relevance and engagement. Healthcare, unfortunately, when it's going well, can be rather boring. And so we have communities, challenges, and other ways of bringing our users back onto the platform, driving them to that bigger vision of better health. I'm excited about the partnerships we've built, as I alluded to before. Our go-to-market is both a B2C and a B2B2C through distribution partners. We have a pricing strategy is basically a per member per month with a fixed medical cost or fixed medical fee to consult the doctors. We also launched a Medicare Part B program well before the pandemic. We partnered with New York City and the Department of Aging, and they actually just renewed our contract earlier. That email popped in 10 minutes before this meeting. So they've opted to re-up their contract with us. And we work with the Department of Aging to reach their at-risk seniors during COVID and now beyond COVID to, again, address those pillars of health as well as medical visits. We support the ground staff and flight crew for Turkish Airlines. We also work with a benefits partner, New Access, and insurance companies as well. Our engagement this year has been a great year for us. We have 200% quarterly growth and kind of tracking along those lines about both retail and Medicare. Our engagement, 79% of our members are engaging on the platform, and that goes beyond the first 90 days, as well as 20% are actually doing a telehealth consult within the first 48 hours of signing up. Our churn rate has dropped to 1% over 90 days, and we're now expanding our billing not just to episodic care, but because we're engaging on the whole healthcare approach, we can engage on RPM billing and CCM billing, and we're going deeper on our verticals with insurance. We're currently raising a Series C at $20 million to again drive further growth, but also we've been approached, and so we are considering early access to the public markets via SPAC or IPO. That's it for me.
Questions have been rolling in. I will call on a few folks to come off mute, say where they're from, ask the question. Ruth Elia, apologies if I mispronounced that. Why don't you kick us off?
Hi, I'm Lilith from Samsung Next. I was wondering, how do you measure your biomarkers that you mentioned?
So it's a great question. There are 10 biomarkers. So when a member comes onto our platform, we actually do, instead of asking them for more, we give them what most people want is a physician visit. And in that 15-minute initial wellness visit, we go through 10 biomarkers. Them can be our objective, like such as LDL, systolic blood pressure, hemoglobin A1C. And there are also self-reported markers such as activity, waist to height ratio. Well, that's still a bit objective. And we take them through understanding how the nutritional components as well. So we do high glycemic foods and other indices as well. So there's 10 biomarkers that we looked at. They can be easily measured remotely. They can be intervened on behaviorally, and they actually apply to kind of reducing your risk of long-term chronic morbidity from metabolic disease.
Thank you.
Esther Dyson, go ahead and ask your question.
Sorry, I'm curious, number one, who you see as your competition? And, you know, there have been things like Aravel and Craig Venter, more focused on genomics. Do you do anything, you know, microbiome, genome, that kind of stuff?
Yeah, so I'll answer the question in reverse. You know, we have been, so when we started Rejuvenan, we focus on these 10 biomarkers because they're the most accessible. We wanted to find diagnostics and biomarkers that could be easily assessed by anyone to capture that bigger funnel. Obviously, in that time, at-home genetic tests have become much more easier, stool tests, gut flora, et cetera. And so we are expanding the biomarkers. And I've, over the past 2 years, have taken to the effect of actually moving people away from thinking so much about the specific biomarkers we're measuring and making sure that we measure the right markers relevant to the right patient. And we have enough data from our physician consultations to start moving in that direction. So where relevant, we take in more information, such as ESR and CRP for inflammatory markers, or kind of looking at integrations with other genetics testings. Fred, who's our chairman, his other companies have done in that field, so it's an easy layup for a partnership as well. In terms of competition, you know, we set up Rejuvenan as really as an ecosystem. We have built what we've built. We expand into what we want to build based on where the client need is, and then we bring in partnerships now to really fill in. So I don't want to, you know, develop my own genetics test. I'll bring in the appropriate partner. But you have seen, and it's really, I see it as really validation, right? Teladoc acquiring Livongo is a move to understand that Teladoc's got 41 million members, but only a 5% engagement on their telehealth, right? That's a huge footprint, low engagement. They recognize the need for longitudinal care. And so that's actually a boost for what we've been saying for years, is that this is actually the way to go. It's not a way of just telemedicine. Sticking a camera between a patient and a doctor is not enough. You need to have a regular engagement that aligns with the member. So, I see greater synergy and validation between companies like, with Teladoc merging with Livongo. Noom is focused just in weight loss, where we're trying to adapt to what the member needs as a whole.